Hi, I'm Dr. Perry Godalovich, and in this video, I'm going to be reviewing the risks and complications for the consent form for an abdominoplasty. Prior to looking at this with me, please view the pre-op for general anesthesia video available on the YouTube channel. For an abdominoplasty, this is a surgery done under general anesthesia. The risks of general anesthesia today is actually safer than driving in a car, but there are some risks that we try and avoid, such as deep vein thrombosis, which is a clot in the legs. In order to do this, we prescribed you some compression socks that you will bring with you for surgery, and a medication called Lovenox that you will inject the morning of surgery, and we will show you how. Other complications of general anesthesia include nausea and vomiting, which is fairly common, and we do give a lot of medications to prevent. But one of the things that you can do to make sure that you avoid having vomiting and nausea at home is to take Gravol 30 minutes before taking your pain medication that has been prescribed for the first day or two after anesthesia. You can also develop an allergic reaction to one of the medications given to you, and if that happens, we will treat it right away. One of the other milder complications of general anesthesia is a sore throat, and this is because there is a tube placed in your throat while you are under general anesthesia to breathe for you. One of the things you can prepare at home for that is some cough drops in order to avoid having to cough, because after an abdominoplasty, every time you cough, it will hurt. A tummy tuck procedure or an abdominoplasty has risks and complications. For the most part, we have very few risks and complications, and what I'm going to do now is run through some of the risks that we know of in the literature, and I will make sure to tell you the things that we've actually seen in our practice. Bleeding or hematoma anytime we cut on skin is a risk, and I've never had one with an abdominoplasty, but it can happen. If this were to happen, you would have an area of intense pain and swelling that looks purplish. Like I said, it has never happened to us in our practice, and you would contact us if you had pain on the emergency line. Bruising is normal after this type of procedure, especially since we always combine this with liposuction. Infection is extremely rare, and we do prescribe antibiotics that you'll be taking for 7 to 10 days after the surgery. Swelling, you will definitely have some swelling after the surgery, and the swelling can persist between 1 up to 6 months, always diminishing. A seroma is a collection of swelling that will happen in the abdominal area once we've removed your drains. So after an abdominoplasty, you will have a drain on either side, which is a small tube that comes out of your incision. We usually remove these drains at 1 week, and if these drains are removed either too quickly or you're too active afterwards, you can develop some of that fluid in the abdominal area, and it needs to be removed, usually with a small poke with a needle. This seroma complication happens in about 10% of patients. The most common complication from abdominoplasty is problems with wound healing. So because these incisions go from hip to hip and around the belly button, along those incisions, sometimes people will have a little trouble healing and little wounds that can open up. If this happens, we always recommend keeping it as dry as possible and as clean as possible. You are to avoid using any special creams or ointments that can only make this worse. Another complication of abdominoplasty is something called skin necrosis. This is when the surgeon is too aggressive in trying to remove too much skin and can actually cause some of the skin to die off. I've only seen this once in my practice, and it was very minor, but it can happen. Another thing that can happen is to the umbilicus. Some people have had surgeries before, and the umbilicus, which is the belly button, can have scars around it. If that is the case, sometimes the belly button cannot survive after abdominoplasty. It's extremely rare, but if it happens, it's actually not a big deal because the belly button is actually a scar from birth. So what happens is your skin will actually scar back down and create a new belly button. It's just a little bit longer to heal. Contour deformities means that the abdomen is not perfectly symmetrical on both sides, and even though we do our best to give you the most symmetrical result possible, sometimes you'll have some small asymmetries and can have some small bumps. If it's something that we can fix, we will, but for the most part, it does equalize over the first year. The scars, as we mentioned, are from hip to hip and around the belly button, and all the scars instructions are available on the scar instruction video that you can click on later. We do not start any scar therapy until at least 1 month after surgery. Diastasis is the space between the muscles that we correct during an abdominoplasty. I have never had a patient open this up, even though it is described, but if you were to gain a whole bunch of weight and then lose it, in theory, you could stretch out the repair. We've actually even had one patient get pregnant after abdominoplasty, and her muscles remained intact. You're going to have numbness after the surgery, and this is normal. The area below the belly button can stay numb forever, and this is just part of the procedure that you have to accept. Patients often ask if the pubic area is going to be lifted during an abdominoplasty, and the answer is yes. Often little minor corrections are needed after an abdominoplasty, and this is because you're lying on your back and we don't want to make the incision too long. These little excess skin on the sides are called dog ears, and they can be removed anywhere after 6 months after surgery when needed. There are different types of abdominoplasty. The traditional abdominoplasty is the scar that goes from hip to hip and around the belly button. There's also something called the fleur-de-lis abdominoplasty. This is for patients who have lost a significant amount of weight, generally in the ballpark of 80 to 100 pounds, in which case there's too much skin, and we also need to make an incision that goes from the base of the chest all the way to the base of the pubis. One of the things that we always mention to patients is that surgery is a contract between me and the patient. There is no guarantee to results. We always do our best to give you the best result possible, but complications can happen. If something happens to you, it's happened to you 100% of the time, even though in the literature or in our practice we only see it 1 in 100 patients. If something does happen, we are here to support you through your healing, and we will make sure that your final aesthetic result is as good as possible. Please continue to read through the minor revision, the moderate revision, and the major revisions surgical fees. And then you can also decide how you would like to consent for medical photography, which is an important part of your chart. For patients who are getting an abdominoplasty with 360 lipo, you can click on the video to understand how the 360 lipo will improve your abdominal.